Hi, I am Dr. Akaram and I will tell about cervicitis. Cervicitis is also known as endocervicitis. So there is a conditions like infection and inflammatory conditions of cervix is called as cervicitis. I will show you the picture of cervix. This is uterus. This one is fallopian tube. This one is ovary and this one is vagina. And this area, you can see it here, is called cervix. In this area, when there is an infection or inflammation, you can see infection or inflammation to this area called cervicitis. Infections or inflammation. This is called cervicitis. So you can see this picture is very clear. When there is an infection in this area, especially to cervix area or cervix, it's called as cervicitis, and it looks like a redness and a little injury type. We can say some erosion type. So this is called cervicitis. And what is the risk factor for this cervicitis is newly partner or multiple partner or people who have STI, sexual transmitted infections. They can transfer through the relations, and who is suffering with some infections, they can cause this cervicitis. And there is exactly, I will tell you, the causative factor for this cervicitis is infections. So some isn't like gonorrhea and virus like human papilloma virus and herpes simplex virus and some inflammatory conditions and injury during relations or with some foreign body and trauma is also causing this one, and PID, pelvic inflammatory disease, also causing. And you can see here when this get injury after during relationship or with some foreign body, this causing cervicitis. And what are the symptoms you are going to see here? What are the main symptoms I will tell you? Mucopurulent discharge. So there is a vaginal discharge you will see, and pelvic pain and vaginal itching and back pain and some you can say post-coital bleeding and dyspareunia. This is symptoms. So mucopurulent discharge, there is a vaginal discharge, it will be white or yellow. Pelvic pain, you will feel some tenderness and mild pain. Vaginal itching is very common and sometimes back pain. Postcoital bleeding is you will feel some spot bleeding after sex or relationship, and dyspareunia, painful intercourse. So these are few cost-effect symptoms for cervicitis. And there is some evaluation how you will come to know that you are suffering with cervicitis. So some serology test and NAAT. NAAT. These are tests where they will collect the sample from here, like swab, and they will send for NET test, and serology where you will get HIV, HBCG, BDRL, and so with pelvic scan. Now this can help you to rule out the cervicitis. And what the treatment you are going to see here. So before treatment, I will tell you some precautions, how you can control and how you can cure yourself and prevent not to spread this cervicitis. One thing, avoid multiple partner and maintain hygiene, keep clean, not to use any chemical irritant, that is also a causative factor for this, and drink lot of water and try to be make distance during treatment. And our treatment role here, treatment will be continue for 1 to 2 weeks as your doctor or gynecologist advise you follow this. Treatment will be 1 to 2 weeks. So there will be antibiotic course, anti-inflammatory drugs, and some other symptomatic treatment which you need to carry as your symptoms. If you have some itching and all, you need to take some Vivas. So was at morning daily. I can use few medications your doctor advice. We need to put some suppository or cream to reduce the itching. And one more thing I'll tell you: if someone is suffering with this kind of symptoms, please visit your doctor or consult with your gynecologist and take a proper treatment. And please share this video.